Dr. Richard Buckley here and team, which this morning means Nurse Yvonne. And our project is microcannular, very fine granular detailed liposuction, lipo shifting, and laser lipo tightening. Actually, our patient is going to be in an event in what, about 4 weeks or so? Yeah, I got a nod there. And so we need to get her ready for that. Nice to have as much lead time as possible with these things. Maybe tilt that just up a little bit more. Yeah. It's nice to have as much lead time as possible before an event to do whatever kind of procedure we're going to do. Most of the time when we work on arms, we're working on some fat that's on the underside, so-called bat wigs. If people hold their arms up, maybe there's something here. But our patient has a bunch of small little irregularities. This green here is areas that are puffed up a little bit. The things I've marked in red are dented in. And so I'm going to work on blending that all together and smoothing that out by some very fine liposuction. I'll suction down these areas that I've marked in green. And I'll shift some fat around so that these areas which are dented in are not dented in anymore. And then I'll give a tightening treatment over the entire area. That's our plan for this morning. Obviously we have 2 arms, so we'll finish this arm and then we'll go to the other. First step always is to do some local numbing, that is to say numbing of the arm. I've actually numbed that little spot right there, and then I'll pop in through that little spot with a tiny needle and I'll numb the rest of the arm. Then we'll work on that and then I'll go to the other side. All right, so stay tuned. Maybe we'll show you a little more. Thank you for watching. Milford.